So this short session is about HIV-associated nephropathy. It's also known as HIVAN, HIV-AN, HIVAN, HIV-associated nephropathy. And I'm going to tell you three crucial concepts, the remarkable concepts of this HIV-associated nephropathy. Number one thing that you need to understand, that when should you suspect HIV-associated nephropathy? You should suspect HIV-associated nephropathy in a patient with HIV who is presenting with a severe proteinuria, heavy proteinuria, nephrotic range proteinuria. You know that nephrotic syndrome, usually patients usually have more than 3.5 gram for 24 hours protein excretion, heavy proteinuria. So this patient will be presenting with a severe, heavy, nephrotic range proteinuria, plus there will be rapidly deteriorating kidney function or renal function. So if an HIV patient, particularly if the CD4 count is less than 200, and it is presenting with two features. One feature is this, that they have nephrotic range or severe proteinuria, and second, their renal function is deteriorating with time, then you should suspect HIV-AN, HIV-associated nephropathy. Second crucial concept is that how to detect or diagnose HIV-associated nephropathy. Currently, there is no other way other than kidney biopsy to diagnose HIV-associated nephropathy. So, number two concept is that you need to perform a kidney biopsy for making a diagnosis, definitive diagnosis. Number three, what is this diagnosis and what is actually this disease and what we see in the renal biopsy? That is, the answer is this, that we basically see a form of FSGS. It's basically HIV-associated nephropathy is basically a glomerular disorder, and glomerular disorders, you know, there are a lot of types: membranous nephropathy, membranous proliferative glomerulonephritis, minimal chain disease. Similarly, a key glomerular disorder which presents with nephrotic syndrome is known as FSGS, focal segmental glomerulosclerosis. And HIV-associated nephropathy is basically an example of focal segmental glomerulosclerosis, particularly the collapsing variant of the focal segmental glomerulosclerosis. The last thing I need to tell you, that would there be any other feature in the kidney? Answer is yes. There could be presence of some inflammation in the interstitium that could be there. And another point, that what do you understand by the concept of FSGS? The last thing I'm finished with this. FSGS, it's a glomerular disorder which presents with nephrotic syndrome in the adult. And to understand FSGS, there are four parts or components in this name: focal, segmental, glomerulosclerosis. So which part of the kidney is affected by this disease? Answer is glomerulus, because the third word is glomerulo. What we see in the glomerulus? Sclerosis, collagen deposition. So we know that this disease is characterized by FSGS, by collagen deposition in the glomeruli, FSGS. Now the question is that focal and segmental, what is the meaning of these two adjectives? In the context of the glomerular pathology, if the word focal is there, it means less than 50% of the glomeruli is affected by that pathology. So if I use the term focal here in focal segmental glomerulosclerosis, it means that less than 50% glomeruli is showing the sclerosis in the renal biopsy. And another adjective is there in the name, focal segmental glomerulosclerosis, that is segmental. Segmental means those glomeruli which are affected, they are showing the sclerosis only a segment and portion, typically less than 50% portion of the glomeruli would be showing that pathology. So this is the basic idea of the FSGS. FSGS is a cause of nephrotic syndrome, key cause of nephrotic syndrome in the adults. And FSGS has a lot of variants. Particular variant is collapsing variant, and collapsing variant FSGS classic example is HIV-associated nephropathy. So what are the three things? Last, to summarize, we need to know about HIV-associated nephropathy. HIV-associated nephropathy typically presents in an HIV patient, particularly the CD4 count is less than 200, you should suspect, with two features. One is nephrotic range proteinuria, because FSGS typically causes nephrotic syndrome, and second, rapidly deteriorating renal function. Second thing, how to diagnose this? Only way to diagnose is kidney biopsy. What you would be seeing in the kidney biopsy? You would be seeing a glomerular disorder, FSGS, particularly the collapsing variant of the FSGS. And we know that FSGS is a key cause of, FSGS stands for focal segmental glomerulosclerosis. It's a key cause of nephrotic syndrome in the adults. And HIVAN, HIV-associated nephropathy, is an example of FSGS. FSGS can also be seen other than HIV patient in heroin abuse, in obese patient, or sickle cell anemia also. So these are some key concepts that you need to keep in mind about the HIV-associated nephropathy. Thank you so much.